MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. We're joining you from the home studio tonight as we streamline our operations. Coming up tonight, we'll get answers to your questions about the coronavirus from a University of Maryland Medical System infectious diseases expert. But first, Governor Hogan today ordering further limits on activity in Maryland in order to slow the spread of the virus. We spoke with the governor from Annapolis. Governor, today you ordered non-essential businesses closed. Let's start with why. Why was that necessary?
Well, we're trying to save the lives of thousands of Marylanders, Jeff, and we just decided we needed to take that action to try to keep more people in their homes. Many states across the country have ordered shelter in place. We just went in a different direction. We're trying to really strongly encourage anybody who doesn't absolutely have to stay in their homes, but we're trying to keep keep the option open for people to go out as long as they're not congregating in groups. But we closed all the schools. We're one of the first in the country to do that, and then we closed bars and restaurants. Again, one of the first states to do that, and we've continually been ramping up in response to this rapidly growing coronavirus threat. And today we just took further actions based on new guidelines that came out from the Department of Homeland Security on Thursday, talking about essential versus non-essential businesses. And we had a 678% spike in cases over the weekend, and that prompted the additional actions just to try to keep more Marylanders safe.
So it sounds like this is a step short of shelter in place. What are individuals, businesses allowed to do? Who can be open and who can patronize those businesses?
Well, so there's a long list of about 1,000 different businesses we don't have time to go through, but they're essential businesses that we're going to keep the supply chain open to make sure people are getting the basic things that they need. You know, stores and pharmacies and banks and all of those things you would normally think of as essential, along with healthcare, if first responders, so doctors and nurses, hospitals, government functions that are providing basic public safety functions. All of those things are still open, and many other businesses. For example, they're in the supply chain, making sure we get people the things that they need. But manufacturing, people that are doing construction maintenance and keeping things operational. But certain other non-essential businesses just that don't have to be open during this crisis, we want to keep them closed so we can keep more people home and keep more people social distancing, so we can break the back of this coronavirus strain. And it really has the potential, hopefully, to keep a couple 100,000 Marylanders from getting the disease, and to keep us from losing a couple thousand Marylanders, and to keep us from overloading the healthcare system all at once, where we don't have enough emergency room capacity, enough ICU beds, or enough ventilators, or personal protective equipment. And that's the kind of thing you're hearing about all across the country. We don't want to look like Italy. We don't want to look like New York. And that's why we've been taking these aggressive actions. But we also announced today a lot of steps to help businesses, particularly small businesses, and those people that are affected, people that are losing their jobs or who are going without a paycheck. So a whole list of economic stimulus efforts to try to help those folks, because we're really fighting this dual problem of the health and safety and saving lives, at the same time trying to help protect our economy, those small business owners and those people who are being impacted by not being able to go to work.
Governor, there was a tweet from the president saying that he was concerned that the cure might be worse than the problem itself, I guess referring to the economic pain that this is causing across the country. He wants to revisit the situation in a week or so. How do you feel about that trade-off?
Well, it's a terrible choice to make, and I don't think it's really a trade-off decision we can make. I mean, some of his experts, Dr. Anthony Fauci, who is the guy who's heading up this effort at the federal level, has talked about the difference between millions of Americans dying or tens of millions of Americans dying. We're talking about, if you just look at the nightly news and you see what's happened in places like Italy, or if you see what's happening right now in New York City, where they're talking about the massive shortages, these are the kinds of things we're trying to stop from happening. And there's just multiple messages coming out of the administration. Obviously, no one wants to hurt the economy and hurt people economically, but we also do want to protect people's health. That's our number one job, is to protect the health and safety of our citizens. And we've got to try to do both of them at the same time. And it's not a great choice. It's a terrible choice to have to make. And that's why we've got to fight both of these wars at the same time. And that's exactly what we tried to do today and what we've been trying to do for weeks, which is why almost every single day we've taken action in both directions, fighting both of these fronts.
How is the healthcare system in Maryland holding up? You mentioned opening up some new facilities. Where are we in terms of capacity right now?
Well, we're trying to increase the capacity of our Maryland healthcare system and our hospital beds by 70%. We're trying to add 6,000 hospital beds to be able to handle the potential surge capacity. That's almost an impossible task to do overnight. But just last week, we through just some additional steps that we took with some of our existing infrastructure, we were able to free up 900 additional beds immediately. We're going to have 1,400 additional beds up and operational by April 1st. We announced today that we, through a joint venture between our Maryland National Guard, the Army Corps of Engineers, working in conjunction with University of Maryland Medical System and Johns Hopkins, we're going to open up a 250-bed field hospital in the Baltimore Convention Center. We're going to reopen the Laurel Hospital in Prince George's County. And all of these are just unprecedented actions to try to get on top of this. And we're also working, I led a call with 52 of America's governors and the vice president and the top leaders of the federal government today, pushing federal leaders to try to help us continue to move forward on all of these issues, FEMA and other agencies, HHS, to try to help get these hospitals operational, but also to help us with these issues of the materials that we need on testing, on the personal protective equipment, on ventilators, and all of this stuff that's going to be critically needed if we have these surges in our hospitals, which you're seeing now in places like New York and California and the state of Washington.
Two more questions, if I can. The availability of testing right now, the physical tests, and the idea that Maryland is going to open some drive-through testing locations. Who's that for? When does it start?
So we've increased our testing capability just in the past 3 or 4 days by 500%, but it's still nowhere near where we need to be. We were one of the first states in America to receive approval to do our own testing. A number of private labs are rapidly ramping up their testing capabilities here in the state. And Johns Hopkins is doing testing. We've got these private facilities that are ramping up. We just got approval today to purchase some additional tests through China. And one of the other things I announced today was an executive order I signed to allow us to move forward without the federal government approval, without FDA, to go ahead and vet our own test and to move forward with the expedited approval to save months off the process to be able to go and get our own testing approved. We also got a great deal of shipments in from the federal government through some of their emergency stockpiles. So we're getting help in all directions from the federal government, from outside of the state, from inside of the state. But it's still obviously far short of what we need. So the current testing is going to be prioritized for those people who are inpatient, people that are in hospitals that really need the tests. And then those folks that the state health department is tracking in their investigations for somebody that's been infected, who they came in contact with. Not everyone does need a test. So if you just have the sniffles or you feel like you're not, you may have a cold, you don't necessarily need a test. So you go on coronavirus.com, you can see all of the symptoms. If your doctor or your hospital really decides that you need a test, we're going to hopefully have those tests available. What we don't need are just tens of thousands of people clogging up the system and overloading it where we don't have tests available for those people who desperately need them.
Last question. You're in meetings morning, noon, night, middle of the night. Probably don't get to see a lot of real people. I was in a grocery store first thing this morning. There is fear and anxiety like you haven't seen in this country since 9/11 or maybe before that. Just looking at people going about their shopping frantically. What would you say to Marylanders? When can we hope to maybe not sound the all clear, but put the majority of this behind us?
Well, first of all, I would say to Marylanders that I do understand the fear and anxiety, and I understand that it's a terribly difficult time. I know that people their lives have been disrupted, and we've never gone through anything like this before in my lifetime, anywhere in the world, let alone here in America or in the state of Maryland. And I don't have, honestly, I said this earlier today, we don't have the answer about how bad is it going to get and how long is it going to last. All I can do is promise you that the best possible people here in our state and are working around the clock to try to do everything we can to keep you safe and to save lives. And we're going to keep doing so. And I believe that if we all pull together, we really are all going to get through this. It's going to be a tough time, and quite frankly, it's going to get worse before it gets better. But I promise you that we're going to come out of it, and it's going to take every one of us in Maryland working together to make sure that we help protect each other. And you can help by staying home and by helping us break the back of this thing by not spreading it around the state.
Governor Larry Hogan, we appreciate your time. We'll let you get back to work. Thanks very much.
Yeah, thank you, Jeff. Thanks, Jeff.
And that was Governor Hogan joining us late this afternoon from the State House. Joining us now is Dr. Fahim Yunus, who is the Chief of Infectious Diseases at the University of Maryland Upper Chesapeake Health. Doctor, thank you very much for being with us. We value your expertise as someone who has treated SARS, Ebola, H1N1. You wrote an op-ed recently saying that so many people are living at either one end of the extreme or the other, denial or panic, and you have another alternative you'd like to suggest.
Thank you very much for having me, Jeff. Yes, that is correct, because in my profession, I see people still either denying it, that this is all hyped up and we are overreacting. And then on the other end, there are people who are just clearing the shelves on the supermarket and they're afraid of every possible surface. And I always tell my family, I tell my patients that here is denial and here is panic. And in between these two places, there's a beautiful place called preparedness. We need to be right in the middle. And I agree with everything the governor just said very eloquently. I think we are a great state. We are coming together. And with that preparedness, we're going to get through with this.
Well, Doctor, the word preparedness, and you think about where we stand as a nation and where maybe we could have stood if there had been some better planning over the years. Is this something that infectious disease specialists have warned about? Was this the big one that you've always worried about?
Yeah, this is the kind of pandemic that you always plan and prepare for, and you do drills, but you hope that you'll never have to go through it. H1N1 about 10 or 11 years ago gave us a punch in the face, as we call it, and we were very prepared, but still the way this pandemic has erupted, I think it's unprecedented. But we will get through it. We are ready for what's coming down the pike. We understand that, but I want to assure people that some very talented people from all different walks of professional life in our hospital system actually are coming together. They're working 12, 14, 16 hours, and they're working with passion that I've never seen before. So I'm very confident that we're going to get through this. And
I have to say, on the behalf of people who are not medical professionals, how much we admire their diligence, their courage in putting themselves into harm's way, and then going home to their families to eat dinner and go to sleep at night. It's a risky business.
Thank you for that, Jeff. But the reality is, and I've told many of my colleagues at the hospital as well, that you mentioned 9/11 earlier and how people were afraid at that time. And I've said this to my colleagues that we are to COVID what our firefighters were to 9/11. I don't feel like I'm making a sacrifice. I feel like this is a calling. We chose this profession for a reason, and we didn't ask for this trial, but now that it has been thrusted upon us, it's our job to make sure that our neighbors, that our county, that our state not just feels safe, but actually is safe. Will we get hit here and there? That is correct. We already have hundreds of our patients in this state. We've lost 3 people. Yes, we will have some damages here and there, but in the end, we're going to cross this bridge.
Has anything surprised you about this disease based on what you're seeing at your hospital so far?
I think these are all good surprises. As I said, it has motivated people in a way that I've not seen before. It has motivated communities. We have random people sending pizzas to doctors and nurses. We have people who hear that we need more masks, and all of a sudden, the husband of one of our colleagues dropped thousands of masks the other day. We have random people contacting us. We have church groups contacting us. How can we help? We have patients who are very accommodating. We have doctors who've rescheduled patients. It's just a very different feeling how the virus is united against us. But I feel like we are also putting a united front against this virus. In our community in Harford County, where I work, I sense that unification. Then among the 13 hospitals of the University of Maryland healthcare system, I see and I sense that unity, that systemness. And then what the governor said really uplifted me, because we are fully aligned from top to the trenches. And I think if we put that unified front against this virus, the virus hopefully will meet its match.
Doctor, let me get to some email questions from viewers. This is Jim writing to ask, after someone recovers from COVID-19, do they have immunity? Is there a way to test for immunity so they can safely work with COVID-19 victims without fear of infection?
Excellent question. I'd love to go through some rapid fire questions. The answer, we don't know, but my 20 years of experience working, treating viral infections, it's very likely that if you fully recover after having COVID, that you're going to have immunity. And that, yes, there is a test in the pipeline. I expect it to be available within a month or two, where we can then test a lot of people who may have had mild disease and who can then serve on the front line. How long that immunity will last, we don't know. But there's a very good chance people will develop immunity.
A couple of questions from Christoph. Number one, I'm 74 years old, reasonably good health, had 2 pneumonia shots last year. Will that provide protection? And part 2 is, he writes that I have one of those ultraviolet portable sanitizing wands. Is this effective?
So unfortunately, the answer is no and no. I don't think the pneumonia shot will protect against COVID, and I'm not aware of any research that shows that that wand will help. What will help is what you said earlier, 74-year-old, healthy, have a positive attitude, wash your hands, live your life.
Here's an interesting question. Somebody wants a check on his logic. He's working 1 day a week, thinking that if he's not working 5 days a week and only going in once a week, he's reducing his risk by 80%. Does it work that way?
That's an interesting question. Yes, you do reduce your risk because that's 80% social distancing from my standpoint. But it is still very important to ask certain questions. The 1 day that the person is going out, is that critical? Is that essential? Can that be done through Skype like we are doing right now? And if it is essential, just make sure that you're washing your hand, that you're covering your cough and sneeze, you're avoiding other people who are sick or not sick, and you're keeping a safe distance, 3 to 6 feet, and you're avoiding handshakes and whatnot. But fundamental question is, if you can do it 4 days a week, why not 5?
You tweeted recently about something a lot of people have been hanging their hat on, hoping that as temperatures warm up, as we get to the summer months, that this virus, well, if not totally die out, maybe be reduced a little bit, as we see with the seasonal flu that goes around. But your tweet shot that down. How do you know?
So, of course, Jeff, I think hope is a wonderful thing, but hope is not a strategy. We need a strategy against this virus. We don't know, but what we know is that past pandemics did not respect weather patterns. We know that right now it's pretty warm in Phoenix, in Florida, in Brazil, in Australia, and in all those warm places, the virus is marching forward resolutely. And we know that this is a novel virus. This is an agent that has jumped from animal kingdom into humans. So my feeling is it's a novelty for this virus. I don't think there is no scientific evidence that the virus is going to respect the weather. What is important is what the governor was saying. We need to practice social distancing so we can bend the back of this curve.
We see pictures on the news of people in other countries and now in the United States getting their temperatures checked. Some sort of scanning device up against their forehead as a way to look for disease. I guess my question is, and so many people I'm sure are at home taking their temperature all the time, is this a reasonable way to search for coronavirus infections?
Yes, I think now that's a strategy. That's a good thing, because what we know is 10 to 15% of the people can remain asymptomatic or very mildly symptomatic among children, among adults. That number varies depending upon which study you look at. And a lot of people may not perceive a low-grade fever when they have one. So figuring out who has a low-grade fever is a very good way for us to screen. So that is a good strategy. We should be doing that.
Doctor, a viewer from Hagerstown has a great question, and there has been some reporting that people who have the virus suddenly lose their sense of smell, their sense of taste. Does the doctor find that those who tested positive say that they lost their sense of smell or taste? Have you seen that?
It's a great question. I think so. The short answer is no, I have not, because we have not seen hundreds and thousands of patients. Symptomatology, we attribute a symptom to a disease once we see it in hundreds of thousands of people. Loss of sense of smell is an extremely non-specific symptom. What I mean by that is whether you have flu or parainfluenza or RSV or any of these seasonal viruses, any of those viruses can cause loss of smell, not just coronavirus. Some people, due to allergies, will lose their sense of smell. So I would say it's a very vague symptom, which it's like saying the weather is bad. Now, you don't know whether it's 100 degrees or whether it's 10 degrees. So it's hard to simply diagnose someone with coronavirus based on this. It could be a whole host of possibilities, coronavirus being one of them. But what we look for is a fever, cough, shortness of breath, body aches, sore throat. Those are the 5 symptoms that we typically look for. If you have 3 or 4 of them and you're not feeling well, good idea to get tested.
What can you do for people in the hospital at this point? Obviously, oxygen, to the extent somebody becomes critically ill, ventilators, I guess. But do you have anything on the medication front?
So far we have experimental medications, but we do not have something that is tested, proven. There's a clinical trial going on with remdesivir, which is one of the drugs. And as you all know, the chloroquine Zithromax combination. But these are experimental drugs typically used late in the disease. What your viewers need to know, Jeff, if 100 people got this infection, 80 of them will not even have to go to the hospital. They'll have a flu-like illness at home and will heal. Another 18 may end up going to the hospital but surviving. 1 or 2 people so far, it seems, out of 100 will die. And they tend to be older with weak immune systems. Those are on biological agents or chemotherapy or dialysis or steroids. So it's a very small subset. But at the same time, when you project that over 6 million people in Maryland, it can turn into a healthcare crisis. And that is why we want to maintain that perspective for an individual, which is a very positive perspective. But we can't rest on our laurels as a community. We have to protect the 6 million citizens.
And you're concerned that if everybody gets this all at once, and everybody shows up at your hospital and every other hospital all at once, you won't be able to do enough for that 18%, and that 1 or 2% number would go way up for that reason. Is that right?
Oh, absolutely. If just 10% of the people in our country, God forbid, got this virus, that will overload our system. We'll have more than 6 million hospitalizations. We simply do not have the capacity. So there's a massive capacity mismatch. And that is why, like the governor was saying, like our whole University of Maryland system is doing, and I'm sure other systems are doing, we're working very, very hard right now to increase our capacity. So the sicker patients who really need that supportive care, whether that's a ventilator or whether that's just a hospitalization for a week or 2 weeks, that we are ready for that.
Dr. Fahim Yunus joining us from the University of Maryland, Upper Chesapeake Health. Dr. Yunus, we have to leave it there. Thank you, and thank you for joining us for Direct Connection. For all of us at MPT, be safe and have a good night.
This program was made by MPT to serve all of our diverse communities.